Okay, so the record is on. So today we are meeting to discuss um, about the isolation and quarantine hospital beds RFP. And during this, when we're going through this meeting, Tony, if you have any questions, please do let me know. And Ernie, please keep a eye on the chat just in case because I cannot see it. All right. Slide. And this is just the agenda that we have today. At the end as well, there's an option for asking questions as well. And let's get started on the overview. Okay, so regarding this RFP, the CDPH is seeking qualified hospital organizations to provide a safe and medically appropriate place for individuals to receive isolation and quarantine and supportive services for infectious diseases such as COVID-19 and other conditions of public health importance. And the city is looking for a hospital organization that can reserve 20 hospital beds within Chicago for this purpose. And then let's also review, the type of clients that this program will serve. So this is any person within the city of Chicago, including people experiencing homelessness and those without an address or identification to prove residency. So that could include asylum seekers, and those residing in congregate living facilities, but it is open to any person within the city of Chicago. And specifically, this is looking for individuals who's tested positive for COVID-19 or other diseases of public health importance who need isolation. And this also includes high-risk individuals that are living in congregate settings who need to quarantine away from those who've tested during an outbreak of COVID-19 and other diseases of public health importance. So this is the kind of clients the hospital will be serving. And Tony, if you have questions, please do let me know.
Yeah.
But okay, awesome. And then in terms of funding that is available for this RFP, there is a total of 8,050,000 that is available through this RFP during the initial contract period that begins from September 1st and it goes through July 31st of 2024 with an option with up to a one extension at the discretion of the city. Um, and of that total 8,050,000, there is 3,500,000 that is available and allowed for expenses of minor renovation and construction. And this portion of the funding can only be used for minor renovation and construction to get the hospital prepared and to be efficient for serving um, as an isolation and quarantine space. And the city reserves the right to review and approve all the renovation and construction proposals associated with this funding. And just as a little bit more additional information regarding the construction, um, I believe that the alterations are only allowed less than 50% of the total square footage of the existing structure. And it can include minor renovations like installation of concrete slabs or modifying certain areas, but obviously it has to be approved by the city. And we will also consider unique cases that will allow for safe and effective delivery of public health services. And one of the other thing with this funding is also that the city, since the city is putting in 3.5 million one-time expense, right? It's for the initial minor renovations and construction. Since the city is putting in a significant amount for that, the city is also looking for organizations or collaborators who are dedicated to maintaining and enhancing that isolation and quarantine capabilities for at least 2 years past the current funding cycle.
Got it. Got it.
Mhm.
Got it. I'm sorry.
Mhm.
Is it opportunity for quick? So, specific to the construction and specific to the submittal of this bid, do
Mhm.
we need to have all the construction quotes completely like flushed out, or could we, through our building services manager, be able to indicate approximate in cost. Our costs will be lie in, AC units, building HVAC to repurpose, and ensure the isolation and non-cross contamination. So I wonder, for purposes of this submittal, will we need to include outside third party related quotes?
I will, I don't know if Ernie or Michelle has an answer to that.
Yeah, it would be good to have outside quotes, just to have them
Good to have.
attached, just to show what
Yeah.
you're actually doing, and it's going to equal up to that.
Got it. And then just my follow up to that is specific to the construction aspect. Is this something that we would be able to showcase the need to receive some upfront costs to, commence construction and then showcase achievements and then receive more dollars? Or is that strictly on like a vouchering basis?
Dibia?
I believe that the city has to approve, and that someone who's eligible, or sorry, someone who's like a city approved construction person would have to like approve that cost in the beginning. And then I will check back regarding the kind of invoicing on the construction. I see that Michelle's also typing. All costs are on a reimbursement basis, is my understanding. Okay.
Okay.
Okay. Awesome. And I will also, there will be a Q&A Q&A that is sent out after this conference. After, I will type up all the answers as well.
Appreciate you. Thank you so much. I appreciate that.
Awesome. Thank you. I was on mute. Sorry. Now we will move on to the scope of work for this RFP. And I've tried to kind of categorize this into the main kind of, top level kind of services that will be provided. But the RFP will give you a little bit more detail on basically everything. And if you have questions along the way, please do let me know. But some of the required services are wraparound services, which includes providing, clean and safe quarantine and isolation space for the client, screening and management of referrals, comprehensive intake procedure that you can also work with the CDPH to, kind of build that up, and the CDPH will also be monitoring the intake. Then also providing clean linen and laundry services, basic toiletries needed for hygiene, and 3 meals per day, and meals that accommodate dietary restrictions for the clients. And other supportive services will also include regular symptom monitoring and wellness checks for the clients, along with behavioral health supports if needed. And some of the other expectations are also that transportation to the isolation facility and back to the place of either residence or shelter, or wherever the clients would like to be dropped off, is taken care of by the hospital organization, and assistance with obtaining government ID if they don't have, proper identification, and other benefits and entitlements, including like SNAP, Medicaid, health insurance navigation, discharge procedures, and housing assistance. So those are some of the other expectations. And then it is also expected that, that the organization will also have infection prevention measures in place, along with medication management and implementation of social services and other health education efforts, just to make sure that the client is completing the quarantine and isolation period successfully.
Got it. So it seems that nothing clinical, just all the support.
Yeah, nothing clinical, just mostly the support, and just making sure that that the usually the main issue with quarantine and isolation is that the actual clients will have to complete that. Sometimes people want to leave, or like premature discontinuation of their basically the quarantine and isolation period. So successfully completing that and giving them support and making sure that when they are discharged, they're going to the right place and they have enough support to continue their medication and care.
Got it. Yep.
Mhm.
Excellent.
Awesome. And then the other thing we wanted to kind of discuss is the site hours. Oops, I think it skipped. Yes, go back. Okay, so here it is, the site hours. So the RFP, the bidders that are applying, we're asking that you guys have the ability to accept referrals within the same day and up to 7 days a week between the hours of 8 a.m. to 8 p.m. And obviously, like extended hours would be really nice and preferred, along with a central intake system, like I kind of previously mentioned. Um, and also a designated phone line and an email address where we can contact with inquiries or referrals between the hours of 8 a.m. and 8 p.m., 7 days a week, and longer hours are preferred for that. And then once the clients are in the actual isolation and quarantine site, there should be regular housekeeping and a 24/7 security guard to ensure clean and safe isolation and quarantine space. And obviously, like the wraparound services would have to be like 24/7 once there are and they have finished their intake, basically. Okay.
And of course, that the hours are that's the minimum. That floor is going to be staffed, I'm sure, 24 hours. So
Exactly.
if
Exactly.
these,
Not 100% with that. Yeah. Yep.
and these hours could actually, be extended, like it says.
Mhm. And if you can, that would be, obviously preferred, and we would really appreciate that. Awesome. And then, any questions before we move on? Tony? Okay.
No,
So
I
this
do
is
not. This is very good. Thank you so much.
awesome. So I also wanted to kind of mention the contract timeline. So this RFP was released on August 7th, and we're having the conference date, bidders conference today. And the deadline for questions will be August 18th by 4 p.m. And you could email Ernie or myself with any questions you have. And the proposal is due September 1st. And the kind of expected start date of the contract is September 1st. And the proposal, please make sure it's completed by 12 p.m. on September 1st.
And that goes right through the iSupplier submittal process.
Yeah, you have to register, and
Yep.
I'll kind of mention that. And yeah, you have to register.
Oh,
If
yeah.
you're
And we
not a
have
vendor,
registered. We're registered.
Oh, good. Yeah. So then you would be able to just go through iSupplier for that.
Perfect. Awesome.
Okay. And then the other submission requirements are, make sure you submit all the required components. That includes staffing plan, budget justification, operational plans, training plans, timeline that you might need, the construction costs that you anticipate, and itemized list of the potential minor renovations that are needed, demonstration of alignment with the CDPH principles, which I will also put in the next slide, and also demonstration of previous government contract and corporate work, which demonstrate required competencies. And this is just a short list of all the things that will need to be submitted. And then these are some of that alignment with CDPH principles that I was talking about on the last slide. So the applicants must demonstrate these principles when you are submitting for this program, and how you would be able to deconstruct racist systems, that there's trauma prevention and trauma informed services, that there is cultural responsiveness and health equity in all the communities. And basically, since the program will be serving people of all of Chicago, we want to make sure that health equity is served as well. Yeah.
Quick question. So
Uh-huh.
I have went through the RFP, and I see that some of these questions do come out in there, but this seems like it's suggesting that there is a like almost like a separate document where these principles will be laid out on and then submitted. Did I get that right? As like a separate attachment, or is that just somewhat embedded in the questions in the narrative section of the RFP?
It's already embedded in the section, so
Oh,
I believe that there's there's like if you need more like clarification, you can let me know. But basically, generally, like the applicants when you submit it, just kind of mention how the program when it is set up, and the duration in the duration of the program, just examples and ways that the applicants would be able to incorporate these principles into the program. So that could
yeah.
include, like, for example, trauma preventative, trauma-informed services. Like you would have people that are trained in trauma-informed services that are providing these in the program and taking care of the clients. Maybe in the deconstructing racist systems, you would be hiring the potential staff members with lived experience or from different backgrounds,
Sure,
things like that are just examples.
sure.
And I believe there's also a section in, I have to see if it's attached in there. If not, I can also send it to you. That kind of lists the examples that we will be using to score. So you could also use that as a guideline.
Excellent. No, thank you very much. That's extremely helpful. Appreciate you.
Yeah. And I believe that should be, just looking through the RFP really quick. Um, there's like a scoring section that should include that. Okay.
Right. No, I know exactly what you're talking about. It kind of shows the
Okay.
different weighting of the specific sections in each of these.
Mhm.
So, yep, definitely.
Awesome. Okay. And then let's see. Oh, if you are interested, here's how to apply. I will also send you the PowerPoint, but it has the link that goes straight to the RFP site.
Yep.
And obviously you can look at the RFP that outlines all the necessary information. And you could also view and download the RFP using that download RFP tool. And then suppliers that are interested must be registered. And then if not, you could use that registration piece to, it's linked there, the registration page, in case you're not registered yet.
Right.
Any questions?
That was very thorough, and I had been through the RFP a few times, and we can imagine at the hospital we talk about these kind of opportunities a lot. So
Mhm.
I believe for right now I'm good. I know that I have until the 18th by 4 p.m. to submit any additional questions. I think perhaps that could lie in some of the stuff specific to construction. So I'm just going to continue the ongoing conversations that I'm having with our building management, just ensuring that we're having a very accurate quote that builds to the total budget. And then
Mhm.
everything else, is pretty straightforward. I definitely understand the wraparound support, the parameters of the program, what's needed. And, needless to say, the hospital that I work with has quite an extensive programming specific to transportation and SNAP and housing and referral. So we feel great. This is a good opportunity for the hospital. So we look to take advantage of it.
Awesome. That's great to hear, Tony. And thank you so much for joining us. And yeah, please do send us emails with any questions, and we'll make sure to get back to you. And also, yeah, just make sure everything's submitted by September 1st
Yeah.
by 12.
Yes, no, definitely. And I really apologize for my technical issues getting on here. I appreciate you, Ernie, for being able to send that link again. So thank you guys. I know where to find you.
Yes.
Questions do come up, I'll be the first one to be reaching out.
Awesome. Yeah, and yeah, connect with us. I've also included our emails in this PowerPoint as well. I'll send this out to you along with, a few of the meeting notes, and there's a follow-up Q&A that, or all the questions that you answered. I'll try to get the as best as an answer as I can, and I'll also send that out.
Outstanding. Really appreciate you. Thank you for a very thorough overview. Ernie, thank you for the opportunity, and I look forward to getting everything finalized for us. So thanks again.
Awesome. Thank you
Awesome.
for joining us.
Thank you, sir.
Thank
a
you
great
guys.
day.
Have a wonderful afternoon.
All right. Bye.
You too. Bye-bye.